I'm Claire Berry. I'm a dental hygienist. I work in the north of England. I've been a hygienist for 10 years and I qualified when I was in the army. Very passionate about dental hygiene and the role of a dental hygienist, and it's great for me to be able to talk to you today about the changing value of hygienists in dental practice and how we can work very well alongside modern day dentists. So the NHS survey findings for 2017 and 2018 found that across the board, dentists, principals and associates had very, very low morale. This was reported as being partly due to the fact that they were worried about the risk of litigation and the increasing costs of indemnity insurance and regulations. So it's not surprising that when Dental Protection released the findings and the figures for periodontitis and implant cases, that 44.7% were periodontitis claims, 28.8% were implant cases, and 5.5% were implant and periodontitis cases. So with statistics like this, it's easy to see why dentists, principal dentists and associates are worried about these things. If the NHS survey is right and dentists are worried about litigation, then to make you feel better about your practice, then having a dental hygienist is definitely of value to you. I think the way that dentistry is starting to evolve, we are starting to see prevention as a very important part of our everyday dentistry. So I think the modern day dentist is starting to see that a hygienist can be an important part of the team and for our patients in order to achieve this. Up to 90% of people have gum disease at some point. And we know that periodontitis doesn't always form from having gum disease or gingivitis, but we know that all cases of periodontitis has been preceded by gingivitis. We should take bleeding gums and bleeding or probing very seriously, and I don't think we take it seriously enough sometimes. What we need to remember is that periodontal cases aren't single episode cases. These are long-term, ongoing cases. This is treatment that is ongoing, long-term treatment plans. And so these cases, go back years, previous dentists, previous hygienists. So we need to remember that these patients need that long-term care. It's not just a one-time thing with periodontitis and periodontal disease. Obviously, I find a dental hygienist is an important part of the dental team. Very biased in that respect. But also, with all the things that I've spoken about, it shows that we should be taken as an important role for the patient's best interests. And I'm not saying dentists can't do this, dentists can, but we do it very well. It's something that we've been trained to do. It's our bread and butter. It's something we do day in, day out on every single patient. So we are experts in that sort of field of practice, I guess. So I think dentists are starting to see the benefits of working alongside a proactive hygienist. Patients benefit, dentists benefit, and their peace of mind that periodontal treatment and implant cases are being addressed and dealt with effectively. The practice in general benefits, and the hygiene profession as a profession benefits.